In the next 60 minutes or 1 hour, we will all go through the assessment that we did together with our agencies and show you the performance for the year, and then we come to the plenary to discuss that. I do this presentation on behalf of the Director PPME, Mrs. Emma Ofori Ajman. Thank you. So we look at the holistic assessment process, how we assess the health sector, and also take attention onto the sector performance by the objectives. We have 3 policy objectives in our medium-term development plan 2022 to 2025. And then in doing this assessment, we encountered some challenges we want to share with you so that together we find solutions to them, and then in the next year we will overcome them. Then we go into the conclusions to know where we stand with respect to this assessment for the year 2022. So as we all know, the holistic assessment is a sector-wide assessment of all the issues that we deal with in the sector. For example, the program of work, the health plans of the agencies of the ministry. And because of that, we derive the scoring and all the assessments from the program of works of the 2022-2025 medium-term plan. We also make sure that the other assessments of the agencies of the ministry and then the budget management centers at the community and district levels are also fed into all these assessments. So if you look at it, it's a bottom-up approach from the community up to the national level. So normally we wait for all the agencies to conduct their performance assessment, which we also take part in this assessment, and then we come to the ultimate, which is a health summit, where we assess the entire health sector and provide the findings for discussion at this forum. So for this year's assessment, because we have a new medium-term plan, we needed to go back and revise the assessment too. The one that we used for 2018 to 2021 had about 4 policy indicators. The new medium-term plan has 3 policy indicators. So we needed to go back and revise the assessment to conform with the objectives that we have. And we selected technical working group from the agencies and the DPs, and then the academia to assist us to revise the 2. So we use that to conduct this year's the assessment for the year 2022. And the 2 also considered the policy objectives in the medium-term plan. The first one is about access to health services. The second policy objective is about how do we reduce the maternal and child deaths and improve adolescent health. And the last one talks about the clinical and public health emergencies. How do we improve access to all those areas?
Professor Richard Adanu, Rector, JCPS, please join us as well. Then Dr. Divine Banyubala, Registrar, MNDC, Doc, please join us as well. I'm told our General Overseer is still with us. I'm sure he's waiting for the last offering before the benediction. So, Prof. Moderator, I humbly hand over to you at this time to begin to say our first. Thank you.
For us in Ghana, universal health coverage is improving access for all, limiting finance as a barrier to accessing healthcare, and making the healthcare financially sustainable so that we can provide timely and optimal healthcare for all. So it ties in very well with what we have. And then for us to do this, our key stakeholders, who we have empaneled here, I must say I have a good array of very reputable experts who cut across various stakeholders of the health system of Ghana. So we have the MOH, who happen to be the presenter, as the head and policy-making agency of the ministry. That's where everything comes from. We have the key implementing agency of the government, Ghana Health Service, also representing all other implementing agencies, faith-based and all the others. Dr. Akuma Boaje is here. We have the training institutions. We've heard a lot about human and health workforce. Director of the Ghana College of Physicians, also representing all the training institutions, is also here. And everything we do, also we need specialist care at the very highest level. So the teaching hospitals are also ably represented by the CEO of the Cape Coast Teaching Hospital. And last but not the least, whatever you do, you must be regulated so that you don't step out of line. The registrar of the Ghana Medical and Dental Council is also here. So you see, I have a very able panel to go through this discussion.
Presentation we have heard this afternoon. It is intriguing to note that we are performing overall fairly good. I think we could have done better as a sector. But it is also notable here that we did not receive all our budget allocation. So if you go into the details, you will see that we fell short of close to 3 billion cedis, if my record serves me right. So we may think that our investment, as expected, did not come, and for that matter, the overall assessment being that. But also worrying is the assessment for Objective 1, which was below average. And largely below average because we could not get the data that we require to do the assessment. I'm wondering whether we've taken steps to address that, or we're going to come back next year having same challenges with data capture. It's also refreshing to know that the majority of our patients go to a district hospitals. I mean, that is why our universal health coverage is linked on primary health care. And it's been presented here that of all the best available, 5.14% patients, 5.14% go to the teaching hospitals. I think that on the surface, we need to go a little deeper to tell what teaching hospitals do, so that 5.14% doesn't look like we are contributing very little to service delivery in Ghana. In fact, the teaching hospitals are mandated to provide advanced tertiary healthcare services and then serve as training grounds for institutions that do training. So, rector does not train. The teaching hospitals largely train. But the colleges coordinate the activity. So it is important that we speak to this 5.14 so that it doesn't become like we are not contributing much to.
I think this approach now is a bit rigid. What I can say is that if I have immunization coverage of 98% and I end up with 97 the following year, I may drop to -1 or something. I think it's a bit rigid. We need to look at it. Is that achievable? I use, for example, OPD per capita of 1.06. Is it bad? We are a youthful population, a relatively healthy population. What is our target for OPD per capita? These are to be factored in assessing the overall score of these areas. One other area that I think I want to also come up with is the denominator we are using. We have been using 4% for 0 to 11 months for the past 30 years. Our total fertility rate has dropped from 7 to about 3.1. Statistical Service gives us 0 to 11 of 2.7%. We are still using 4%. And so what happens is that as the denominator enlarges, your coverages continue to drop because it's getting bigger. And definitely the 0 to 11 is not 4%. And it's also not 2.7%. We need to find where really it is so that we can have some. Otherwise, next year the maternal and child health indicators will continue to drop because the denominator gets bigger and bigger. 4% of 32 million is going to be bigger. 4% of 33 million is going to be bigger. And so I think those are the areas I want to look at. But looking at broadly, I think what I can see is that the support systems are not working. If you look at the indicators, tracer medicines are down, HR issues are there, inequity issues are occurring. We have areas of insurance that is creating a problem. If you see the claims continue to drop, I think it's about time that there has to be a benchmark to say that whatever you receive, this minimum percentage must go into claims.
Well, the presentation is that, at least for me, when I listen to a presentation on assessments, I want to be able to, I obviously don't expect to remember every single thing that's been said, but I want to be able to go away saying that, are we doing well or are we not doing well? That's probably a simplistic view, but that's kind of like how I think about it. And in a sense, the report as presented makes it difficult to answer that question. Partly because the targets for different things were not mentioned. Because a helpful way would be to have what the target is and then what we achieve. Then you're kind of like taking it up in your mind that it looks like we're doing well. So, it's a good presentation, but it would be great to kind of like try to cater for those of us who think simply and just put that kind of thing there so that we can take how it goes. And are we having an impact on people out there? That's where things like morbidity, mortality, and life expectancy data might help. Having said that, the other thing is it would be helpful if the methods that we use are modified in the light of discussions that are held out here. Because what Dr. Boaji just said, he said the exact same thing last year. Nothing's changed in terms of the percentages and talking with Ghana Statistical Services. I'm also about to say something that I said again last year. I hope I won't say it again next year, or maybe that would cause you not to invite me next year. It's the whole thing about the skilled birth attendants. When I see it, I'm always like, what denominator is being used here? In the afternoon, we'll be hearing about the demographic and health survey data. I haven't seen that. I don't know the numbers. But I'm sure what we'll hear about skilled birth attendants there might be about 70 to 80% coverage. And then we are saying that for ourselves, it is about between 50 and 60. So what numbers are we using to get to that? So it would be good to kind of like hold this together with survey data and not just kind of like run an algorithm that sits there all the time. Because we are saying that we are covering only 60%. Then external people run a survey and say we are covering 80%. And I say it's not true, we're actually doing worse than you are saying. And we shouldn't kind of like be going that way.
I think that my general comments are that this was a fantastic presentation, and we want to thank the ministry, especially the directorate responsible. And Eric, you did a fantastic job. So the conversations here are just what we could do better, so that we can move. Excellence is always an aspiration. And I'm just following up on our moderator's lead. When I was listening to, from a regulatory perspective, you hear doctor-patient population ratio, nurse population ratio, and it may look good. The first thing is that the focus reference was to doctors, for example, on government payroll. Now, that immediately presents a problem as to the sufficiency of the broader consideration and whether or not we are not undervaluing our output. And therefore, if we examine it like that, then the second level is we need to have a much more nuanced and reflective approach. What is the regional distribution of these numbers? And are we just satisfied with the gross numbers, or we are interested also in the skills mix, so that we are able to disaggregate these data, not just according to region and facility type, whether they are teaching hospitals or the regional hospitals, whether they are CHAG or quasi-governmental or private, but also what are the specialists we have? Because we cannot have a focused approach to driving quality, safe, basic healthcare services for every Ghanaian everywhere in this country without having a focus on the type of personnel and at what level. And it worries from a regulatory perspective greatly when there are still issues of maldistribution. Let me put it this way: inequalities in the distribution of numbers. Then these inequalities over the years have not been sufficiently addressed. Then the transition to inequities.
Give us this feedback. We appreciate it. We'll go back, and next year these issues will be addressed in the report. What I want to also say is that there are other issues that, for the sake of time, we decided to put them in the report, which will be shared. So the presentation focus on, we're so much interested in the indicators that we report to the global databases. But when we share the report, we'll see some of other national level indicators. But I think one key thing I want to look at when we go is the disaggregation into the different specialties for doctors, nurses, and all those things. So that even if you are doing very well, we need to see with respect to these specialties. It's something that we will do. The challenge has always been the data that we, but we will still contact the agencies and get them to do those things. Thank you very much.
Great. I think, again, as you mentioned, the data and the issues that may arise, Prof. Adano mentioned it. Do we realistically believe that skill delivery is about the lowest in Greater Accra region? On the face of it, and what we see around, there are many mothers are delivering outside health facilities in Greater Accra region. So there are things we will need to question as we go forward. And it's by so doing that we will improve the system, as Dr. Isiam was.